presenter for today. Thank you so much for your patience. I apologize for the technical difficulties. Welcome to our program, How to Become an RN Nurse 101. So we'll go ahead and get started. This program is brought to you by AMWPA, American Muslim Women's Physician Association, nonprofit organization working to help educate the community and provide preventative care for the community. You can see on our presentation, our current president is Dr. Seema Huq. All right, our vision and mission for our organization, kind of what we already went over is, educating the welfare and, community for, our Muslim brothers and sisters, and educating our young, Muslim brothers and sisters to enter into the healthcare community, empowering women to enter into nursing, medical fields, dentistry, allied health positions as well. If you have any questions, you can contact us on our webpage, with your name and email address for any questions or concerns, or if you are interested in joining our organization to help volunteer as well. Nursing and AMWPA, let me see here. AMWPA Nursing, a little bit of what we do for the community, specifically was our pilot project of Family and Friends CPR, educating the community by saving lives, knowing how to perform CPR in emergent situations. Alhamdulillah, we've done over 500, educated 500 students throughout the community, throughout all the masjids in the Metroplex, through Plano, McKinney, DFW area, and Hurst-Euless Bedford area as well. Our nurses that participate in this program specifically is Zara, Ruba, and Amina, and myself. Have a great team that helps, throughout the community to help fulfill these classes and educating and empowering our Muslim community to perform this life-saving act. Just kind of a short roadmap of what we'll go over, how entering into the healthcare field and knowing how to get started in that. The main thing is, before you enter nursing, I think it's really important that you ask yourself why you want to enter into this career. It's not an easy career lifestyle to have, and you have to have a good mission for yourself of why you want to enter into this position, whether it's for the sake of Allah and helping others, caring for the sick, and reaping the rewards of that through our religion, what our religion strives for, as well as, having that passion for science, knowing, that you want to practice medicine or nursing, and, practically, learn these healthcare concepts and then fulfilling them in practical experiences through patient care. When you enter nursing, there's not just one area that you can go into. There's a vast, variety of different specialties that you can enter into, whether that's bedside nursing, home health nursing, learning procedural areas, cardiac cath lab, dialysis. There's even subspecialties, in different age-related, specialties of pediatrics, labor and delivery, geriatrics, and then nursing leadership and management, which kind of goes outside that bedside nursing, but also has a very great opportunity, in that career. The main thing is, when you enter into the nursing, programs, there's different variety of degrees that you can fulfill. And so the main thing is that, there's the bachelor's degree nursing that you can fulfill. There's also associate's degree and licensed vocational nursing. The main thing is with the bachelor's degree, it's a 4-year degree program, whereas the associates and licensed vocational are 2-year programs. A lot of hospitals are now requiring that they want nurses to have a bachelor's degree because there's something called a magnet status that we're trying to strive for, and that one of those requirements is having a bachelor's trained nurses. And so I always educate the young community, if you can, try to strive for that bachelor's degree, fresh off the bat, so you have that ready to go, have a good job opportunity whenever you graduate. One thing is, when you decide you want to become a nurse, what stage are you in that you are trying to fulfill this? If you're a high school student, there's a lot that you can do on preparing yourself in order to enter into this career. Whereas, where a lot of, high school programs in their junior or senior year offer things called health science technology programs. And in that they have phlebotomy courses, and they also have opportunities for, students to go around in the hospital, see, shadowing with a nurse on the floor. And so that gives you a great opportunity for even on your application whenever you're entering nursing school during the college years. And as well, the other thing is, obtaining a certified nurse aid license. Another thing that you can do whenever you're in high school and trying to apply into the programs. This is a job opportunity that you can actually have before even entering into the, college setting sometimes. And so that you get one-on-one experience working in the hospital, being, side by side with nurses, building that rapport with nurses, and also having your application in that hospital, environment. So they're familiar with you, whether it's Baylor, Methodist, Texas Health Resources, if you're in their system, in some kind of position or the other, it increases your chances and moving forward or up the ladder in nursing, and other areas of nursing as well, whether it's nurse leadership and here on out. The other thing is whenever you're in high school, looking at opportunities for, good application ranks whenever you're trying to get into the program. So, making sure that your SAT scores are very high, that increases your ranks and sometimes even can help allow for direct seat admissions whenever you intend nursing as your major. Schools recognize that and they really appreciate it whenever they see good ranks in their college applications and on your entrance exam for SAT or ACT scores. The other thing is whenever, you are applying, it's important that you familiarize yourself with what's the entrance process. So knowing your prerequisites, knowing, what kind of entrance exams is in that university that you're wanting to apply to. And as well, knowing that, the exit exams and then the board licensure, getting familiar with that early on now so that you have a roadmap for yourself and entering to the program and succeeding well. So the next thing is the prerequisites that we talk about. And so in the prerequisites, the main thing is, there's the basics that you always hear in the first 2 years of your college program, English composition, political science, history, and then we start leaning down into the science application, prerequisites. And so that's biology 1 and 2, chemistry, anatomy, physiology, microbiology. You'll have like a college algebra and statistics program that you'll have to do. And then there's some programs that are dependent on where you go. So whether it's nutrition or intro to psychology, sociology, anthropology, these will kind of vary. And so you have to see what your nursing program is requiring so that you can have that as well in your application. Some programs will require some advanced classes even before you apply. So that could include pathophysiology and pharmacology. I personally graduated from University of Texas at Arlington as a nurse for my bachelor's degree. And so I had to take pharmacology and pathophysiology before even entering into the program. Whereas other programs might require that once after you've started your nursing degree and everything there. The next thing is knowing what universities are nearby that are offering the Bachelor's of Science Nursing degrees that are local to us. And so University of Texas at Arlington, Texas Women's University in Dallas, and then some further out like Baylor or TCU are also there. The main thing is for the ranks of, licensure pass rates is really important that you familiarize yourself with. Locally, University of Texas Arlington and Texas Women's University have really great rankings on their licensure pass rate. And so knowing that also is very helpful so that you know that you're well prepared for taking that NCLEX exam and getting your license at the end of the road. Just a couple things. These are just some sample degree plans that you'll see, and so some of them can vary. The main thing is, kind of knowing those basics, and then knowing ahead of time what kind of specific prerequisites that program might need for your degree plan. And so looking at that early on is important if you intend yourself as a nursing major. And then the other thing is, Baylor University and Texas Christian University also has some degree plans, so they can vary. I encourage you guys to look on their websites, get a good feel about what they're going to be needing for their applications. And so you can have that, that school schedule ready to go and knowing whenever you need to take those classes appropriately and knowing when to apply for your applications ahead of time so that you have that adequate 4-year degree plan for yourself. And the next thing is once you know where you want to apply to nursing school, the next step is actually taking those entrance exams and putting your applications in. That can vary. The nursing class, database that's there. That's one application source that's there. Apply Texas sometimes partners with universities specifically, and so your university will let you know where that application database has to go. The other thing is the entrance exam. There's two main types: HESI exam and the TEAS exam. University of Texas at Arlington and TWU predominantly use the TEAS program for their entrance exams, and then HESI might more toward like maybe TCU or Baylor that might use that. But I encourage you to look on the university websites and seeing what those entrance exams are, getting prepared ahead of time. There are sometimes wait periods if you don't successfully, pass that admissions exam the first time. There are wait periods, and so knowing, when those wait periods will be, so that you can plan ahead of time for making sure that your applications are submitted appropriately and that your start date, is on the same track that you desire. Sometimes you can see that if you do a practice admissions exam on maybe another university campus that you might not be applying to, it might still give you some leeway on where you don't have to wait that full maybe 6-month period or so to reapply for the exam. So, kind of familiarizing yourself, maybe if there's maybe a pre-testing or a practice testing version that you would like to do, that is also beneficial to get yourself prepared enough for entering into the programs. The other thing is, once you enter nursing school, a lot of what we kind of talk about is being in survival mode. It's a tough program, to be honest, and so you have to be prepared, very well organized. Both you get in-class and hospital clinicals in that program, so that's very nice that you get actually in class version, but you also get practical experience. You get to go on the floors, you get to see side by side to see nurses, what they do, interacting with physicians, how they do that, how they follow delegation of orders and everything as well. The main thing is with the curriculum, what can you expect whenever you are in your nursing program? You will get that pathophysiology, pharmacology, and then you get specified nursing programs such as adult nursing classes, foundations of nursing, geriatric nursing, pediatric, labor and delivery, ICU, mental health nursing. So it's quite a privilege actually that you get to, as a young student, you get to actually get into the field, look at all these different areas. You don't get that a lot of times in a lot of programs because you usually will wait till after graduation and you're going to start your job and it's in one area. Whereas before you even enter your career, you're into this program, you get to see all these different areas of specialty, so that you can actually find for yourself what kind of specialty you want to pursue in your career. So I appreciate that quite a bit whenever I was in my nursing program. The other thing that you get to look at as well is community health nursing, nursing research, nursing leadership and management. That's also really important, so that whenever, say, you're in your career 5-10 years down the line and you want to enter into something advanced like leadership or research, you get a feel for what that would be, and also kind of helping to promote good access to care with that nursing research. If there's things in the as you're working in your career, you realize there are not some perfect things that are out there, and you want to engage yourself in evidence-based practice, learning better ways to improve the management of healthcare conditions. It's a great opportunity that I encourage a lot of nurses to get into as well. The other thing is, when you're in your program, I always emphasize it's really important that you build your resume before you graduate. It's going to help you secure job positions very well. The main thing is, that's one thing that's while you're in your nursing program that you can take advantage of is nurse externship programs. They're application based at certain times of the year. As you can see on the screen, Scottish Rite offers one as well. There's one at Cook Children's. The other thing is, looking at Baylor Plano hospitals or Methodist hospitals on their websites, they'll commonly say, oh, student nurse positions or patient care technician positions. Any number of those kind of opportunities are really important that I emphasize nursing students to get into. You can actually get the patient care technician and the certified nurse aide positions even before you are in your nursing program. So even, say you're applying to nursing school, I educate students to make sure to take advantage, maybe apply to those positions even before you enter your program. So that helps you secure a seat into the nursing degree that you want to enter into. The main thing at the end of the road, so whenever you're in your nursing program, now you're in your senior year, you got to get ready for graduation. And there's quite a bit that happens in your last year of nursing school. Exit HESI is actually an exit exam that you have to take before you can graduate and sit for your nursing licensure. Then there's job applications. A lot of people don't know you can apply for jobs even before you graduate. That's actually pretty amazing that you can secure a job before your degree ends and have that ready to go. So I think that's I appreciate that quite a bit from entry into the nursing field, that I was able to have a job before graduation. The other thing is actually graduation and then sitting for your licensure. So we'll get into that here a little bit. One thing here, you have the exit essay exam. A lot of people don't know they have to take that at the end of the course that they have, and it's really important. It's in your senior year. You know, it's required to graduate from nursing school, and even to be able to be eligible to take your NCLEX exam. The last thing here is the graduate nurse and nurse residency applications. So a lot of people don't, mention like they don't know that they can have a job before they graduate. These positions are called GN or graduate nurse positions or nurse residency job applications. There's 2 to 3 times a year when these open up. So it's really important that you familiarize yourself on looking at the hospital websites that you want to enter into. When do they typically have these nurse residency applications open up, and getting ready for those early on. Tentatively, it's usually like the first week of September, and then there's one in maybe mid-February to March that they have, depending on whether you're going to be a fall graduate or a spring graduate. The hospitals that will offer these residency positions will be Texas Health Resources, Baylor, Parkland Hospital, Methodist, Children's, Scottish Rite, Cook Children's. They offer a number of nurse residency positions, and they actually are divided into the type of specialty, whether you want to enter into ER, labor and delivery, postpartum. So kind of familiarizing yourself with what you want to enter as a specialty, toward the end of graduation is also important, that you kind of, secure what's your desires for that, and applying for a few different type of specialties, so that you can enter into the programs, have a good spot at the end of graduation. The next thing is when your graduation's done, there's still one more step at the end of the road before you're completely finished with the program, or actually for entering into the career. And so what that is actually applying for licensure. So the Texas Board of Nursing is where you will do that. You apply for licensure. They'll actually have you register for testing at a testing center called Pearson VUE. You have to take the nursing jurisprudence exam, which basically is kind of a law exam of nursing laws, actually. Nothing too complicated, but it's offered through the Board of Nursing, and so you take that exam. And then once you pass that, you will receive something called an authorization to test. And so with this, what happens is that it's a ticket for you to sit for your NCLEX exam. You usually have about 45 days or so, 45 to 75 days, if I remember correctly, to sit for that exam. And so once you have that ready to go, you can actually, study for your exam and then take that desired test on the testing date that you've secured at Pearson VUE Testing Center. The main thing with NCLEX, it's important that you make sure not to wait too long after graduation to take this exam. The reason for that, a lot of studies actually show that students that wait too long will not pass the exam. You want it to be like within 3 to 4 weeks out after you finished your courses, you graduated, you want to go ahead and sit for that exam. It's a tough exam, but don't be afraid of it. I always encourage students, be confident in yourself and what you've learned, work hard, study good and take that exam. Don't be afraid of it. You do the best you can and take it early on so that you can have the higher chances, for passing and getting started with your career. I see a lot of roadblocks at the end, where students waited too long. They're having a hard time passing. They can't get into the field. And so main thing is take advantage of all that you've learned. It's all fresh on your mind after you graduate. Take advantage of that. Be confident, sit for those exams, do the best you can, and get started on the career that you've worked really hard for. The last thing here is that once you pass, you can start living the RN life. And so this is a little bit fun meme that I have here, that who says nursing is stressful? You can see this lady, she's quite old, and she says, I'm 39 and I feel great. So, the main thing is you have to laugh about it. You'll see quite a bit of memes about nursing. There's a lot of stress in the field, but you always have your coworkers that's with you. It's like a family because you go through so much together. The field is very hard, but you build a family at work, actually, and that's what keeps you guys going. You guys, we all are doing a great job, especially during COVID, working so hard to be there for the community, our frontline workers, especially at this time is where we're really tested because it's quite hard putting ourselves and our family at risk. But that's the main thing is I always encourage nurses. It's going to be hard. Laugh through it. Be happy. Spend it with your family, coworkers at your work family, and make the best of it and be there for the community, and for the public, whenever times are at its worst. Be that helping hand, that shoulder to cry on to, because they need that. Patients won't always be the nicest, but the main thing is to understand that they're going through some very tough times, and we'll be that shoulder to cry on, a helping hand for them at all times. Just a couple things that I didn't go through here, I want to just kind of touch base. Whenever you are in your early applications, I think it's important that you take advantage of these scholarship opportunities, or securing good opportunities for pursuing to the program financially. And so one thing is AMWPA does offer allied health scholarships. I encourage you to log on to our website and see when those open up, apply for those. When you enter into nursing, there's also a lot of scholarships that'll pop up. So familiarize yourself with that with your university and seeing what applications are there, applying for those early on. If you enter into state programs like UT Arlington, actually, they sometimes have a Maverick Promise. And so if you, as your first, bachelor's degree, they'll offer you grants. And so, you can technically get your first bachelor's degree for free. If you had really great ranks, like you're in top 10%, sometimes you get a coordinating board top 10% scholarship. And so sometimes you can get paid even be going to school in those first couple of years of your program. So I encourage you guys to look into those opportunities. There's quite a bit out there. We need nurses in the field, actually. And so a lot of opportunities are out there to help financially support you whenever you're going through the program. The other thing was accelerated program was one thing I wanted to touch base on. So when you're applying, you'll commonly see something called accelerated program. And so this is actually an online program that actually can be an accelerated track for nurses, for students that want to become nurses. It works great for people that are already working and they're looking at this sometimes even like as a second career. It's a great opportunity to get ahead of the game. And so that's the one thing that I always encourage people to also look into as a different type of school environment where it's, online rather than in class and, having to dedicate, Monday through Friday, a whole bunch of time into the program whenever you might have other responsibilities like another full-time job. The other thing is, the one thing that I was going to kind of touch base is also, in Islam, there's a lot that says, we have to care for the sick and the benefits of that. Even through nursing, you'll commonly hear about nursing care model, like Florence Nightingale, with that as well, knowing that it's important to care for others and have that in your heart. I always encourage, students that are willing to enter the field as a Muslim female, don't be afraid. The main thing is that, it's important that you realize that this is for our religion. We're caring for the sick. You are going to receive multiple benefits from that, in order to help kind of be that smiling face and that helping hand for others. Don't be afraid. I'll be honest, I'm always usually the only hijabi that's out there whenever I was in my, early on in my field, whenever I was applying to nurse residency, when I was in NP school. And so I want to see more females, Muslim females out in their field. I want to have that woman empowerment there. So I'm happy that I could be here today for educating you guys, on how to enter into the nursing program. If you have any questions or concerns, definitely reach out to us. We will actually now have a question and answer session. And so I will go ahead and have people go ahead and open the chat box so that we can start that and direct these over to our panelists to answer these. Let me go ahead and see if I can do that here. Let's see.
Aisha, we lost your speaker. Aisha? Can you hear me, Aisha? We can't hear you.
Can you hear me now?
Yes.
Okay, all right. And Isra, is this, let's see here. Okay, so I'm gonna go ahead and repeat the question here. Let's see. Is there a direct program from high school to enter into the nursing program? If so, what is the requirements in the school? So I'd like to direct this over to our current nursing student, Isra. Would you be able to answer that for us?
Yeah, of course. So there is not really a program that will take you from high school graduation to the nursing program without requiring prerequisites, unless there are many students that are now graduating with their associate's degree. So they're going ahead and doing dual credit within their high school before they graduate. So they're already graduating with those science classes and their basic associates classes. However, there's some nursing programs that have certain requirements. Texas Women's, they require nutrition. which is a lot of the time is not offered as a dual credit. But I recommend if you do as many dual credit classes as you can in high school, you'll only have, once you graduate, you'll only have about a semester of classes left, maybe 2 semesters for those A&P microbiology courses, and then you can apply into the nursing program. Now, if you want to just go ahead and get started with the nursing program, there is, Aisha mentioned, the RN, the 2-year program versus the 4-year program, which I know is offered at TCC, and you basically graduate as within 2 years. However, most hospitals are requiring that you have your BSN, your bachelor's, versus just the 2-year degree. I do have friends that are doing that, and then they're completing their bachelor's degree online, and the hospital that they're working for is paying for their completion of their studies. So it's really up to you and what you want to do. There's accelerated programs, as Aisha mentioned. But as for a direct program, all programs are going to require prerequisites. So the faster you get those done, the faster you get into the program.
All right, perfect, thank you. Now another question we have is there a dual program with MBA and nursing? I haven't seen one personally. Do any of our panelists have, can add to that? If maybe you guys heard of that before? Maybe, let's see here.
There are 2 separate degrees, as far as I know.
Okay. Yeah,
My supervisor has a degree in MBA, and then he went into nursing for 2 years. So he has an associate's in nursing, and he has bachelor's in business.
Yeah, I've seen it only there's a biomedical engineering and MBA, I think, and maybe an MD program sometimes. I haven't never seen it actually for nursing itself. So, all right. And then any other questions here from our attendees? I'll give it a minute here.
Just to add on to the MBA, you could do your 4 years BSN, and then once you graduate and you're working, you can work on getting your MBA.
So in one question, what is the base salary of a nurse? So that's a good question. It depends. Whenever you enter, I can answer this one. Whenever you enter the field, there's a lot of nurse residency sometimes people that are offering it. That could vary between maybe like 60,000, 75,000 sometimes. It depends how long you're in the field longer. You get those pay increases, and then whenever you do have, oh sorry, someone. Can you guys hear me at this point?
Aisha, you're coming in and out, honey.
Okay, let me see if I can bring this up. How's this? Maybe
It's good.
Much better.
it's good. Okay. Okay, so the one thing is the salary, it does range like hourly rate, and actually whenever you first enter, it is less. Whenever you do have your first or second year of your experience, if you transfer sometimes to another hospital, you'll see that the pay increase can go up. So, you know, I always kind of give it a range 65 to maybe 75,000 as, you know, those initial starting rates in the field. And then the other thing is, you know, once you decide, say you want to enter into advanced fields such as nurse practitioner, masters in nursing, the pay rates do go up. NPs can have a base rate from, you know, 90,000 to 120,000. When you're in the field longer, you know, I think the cap rate that I've seen it go up to maybe is 150,000 sometimes. If you're in a specialty, that goes more. So the main thing is this dependent on how many years of experience and also the degrees that you have. And so if you have a bachelor's and you want to go up to your master's, there is quite a bit of a pay increase on the salary there. The next thing we have a question on is how do you get into administrative positions of nursing? Do any of our panelists want to answer that question? Maybe Farah, do you have maybe some input on that?
Sure. So administrative positions, basically the best way to get into any type of administrative positions is based off your experience. So working as an RN on the floor and taking the lead, becoming one of the lead nurses like on the floor, and going from there based off your experience, and you're able to get into that. Now, furthering your education as well by getting a master's degree or going into DNP doctorate positions, that will all help you in getting those type of positions.
Thank you. And I have one question from a panelist, or sorry, attendee. They have their bachelor's degree equivalent to an MD. How can I enter into the nursing like I did BSN, or sorry, how can I enter into the nursing field? Do I do a bachelor's degree first or associates? Ruba, would you like to answer that one?
Sure. So yeah. So they still require you to have the requirement classes. So you still have to check the boxes on those specific classes. So I know MD required biology 1 and 2, but nursing A and B 1 and 2. So there's a different classes, and I did not hear of such like from MD to nursing. You still have to complete that prereq. And if they include it, then good. If not, then you have to take the missing classes and then apply for it. And just for sure, you have to choose the college and contact the counselor with them, the education department in there. Thank you.
Very good, thank you. One more question.
Hey, Aisha.
Yes.
Hey, Aisha, just to add to that, I had a biology degree before getting my BSN, and I did the accelerated 15-month program. There's just a couple of prereqs that you have to apply to and get into. Once those are completed, then you can do the 15-month accelerated program.
Okay, perfect. So a lot of times classes sometimes can, interface with what the prerequisites are, and then you just take over.
Correct. Correct.
All right. And one more question we had, is it more demanding in the ER compared to other specialties? Gian, do you want to answer that one?
Yes. So ED does, you just don't know what's going to come through those doors, and you have to be prepared. You're on your feet. Sometimes you're working for 12 hours and you barely get a break, or barely get a lunch. But you do have a team of players that are right there with you, so you're not alone. Whether it's a complete unresponsive patient or a stroke patient, you always have a group of people that are there that are tackling the problem at the same time. So I think just that the concept of teamwork, if you're into teamwork and if you're into that type of environment, then you'll flourish in the ED. And that's what I'm loving about it. I've been there just barely a year, and I love every second of it. You learn something new every day. And if that's what you're into, then you'll love it.
All right, thank you. Zara, I'd also like to, and Ruba, Zara, if you want to add to that as well, you work in the ED as well as Ruba.
So it is definitely demanding to work in the ED. I have been an ER nurse for the past 18 years. And if you're looking into growth of yourself, of the medicine field, if you're a good team worker, then and if you can take the demands of ED, because you really don't know what happens in the split of a second, anything can change. If you're one of that fast-paced person who can handle multiple tasks and prioritize, then ED is something that you grow into eventually and gradually. It's not like a one-day thing, you just learn it. Every day for the past 18 years, even till today, I have been learning something new, whether it be from a new nurse or whether from a doctor, from a patient, from a family perspective. So it's an ongoing, growing field. About the raise in ED is a little bit more than the regular floors, as far as I know. because to stay in ED, you have to get certain certifications to stay in ED, and they're more like critical stuff. And then as you take those classes and up your, role in the ED, you do get a good raise every single time, depending on the hospital that you work at. But yes, ED, to answer it in short, it's very demanding.
Mhm. And I think Ruba might have had to log out. She's at work, so she got an hour off. So I think she's no longer on. I had one more question here. How can we attract our community students to get into nursing programs, which is a noble profession? Amina, would you like to answer that one?
I would say maybe like when they are in the nursing, like in the high school, we can have like more volunteering programs at the hospital. Like I know some of the schools, they are looking for it, but they are not getting like enough support from the hospitals, I think. Like they don't know how to get into the, how to get the support from the hospital. So if we can do that one, like more kids, more students, they will get to know about the hospital settings. And I know like some of them, they're really looking for it, but they are not getting like in our school, I know they don't have like too much exposure to the hospital settings. So I think like that is one of the best thing we can do.
Yeah, I can see that too. Like where sometimes, you see pre-med students, they go to clinics, like physicians' own clinics, and they can shadow with them. I do see that as a roadblock a lot of times for nursing, because we all work in hospitals. They do have quite a bit of restrictions of allowing people to shadow because of, confidentiality, HIPAA laws and everything for our patients that are in the hospital. One thing is that there's that a lot of high school programs to add to that. Health science technology was something when I was in high school over 10 years ago, but they used to have that in your senior year. You could apply to that, and they had phlebotomy, but they also had something where you could shadow in the hospital. I believe some programs in Plano, they also have these students. Whenever I was on the floor, I used to see students come into the hospital to shadow nurses. So educating yourself on, kind of seeing what high school programs could offer. There's also something called Richland Collegiate Program that I've seen around the Plano area, where they basically can finish like a 2-year associates and their high school senior year together, and they get credits quite a bit. There's a lot of volunteer programs. So that's a really great community college that I see empowers a lot of students in that transition from high school to college, getting as much as you can certification wise, or, completing classes wise. So looking into that as well, I'd encourage students to know, in order to kind of get that feel for, what kind of field is nursing. You won't really know until you're shadowing a nurse. You see what that day-to-day life is. And so, you can get that in nursing school once you've already applied. But if you can get that on the floor, if there's any opportunities that are out there, I would say take advantage of it. Honestly, it's hard because on your own, like, asking a nurse, can I shadow? There's a lot of laws, there's restrictions or policies with the hospitals. So if they're partnered with a school or, like a community college, or in some way, these hospitals do partner with some of the schools in order to allow students to transition and get that experience that they want.
And also, I think like if you get into like a nurse aid degree or something, and then you start the hospital, if you start working in the hospital, I think the hospital has like, some hospital has like the grow your own program, right? Like they will pay you for it. They will pay your nursing degree, like the whole thing.
Yes, yes.
Your job is also guaranteed, because you have to work there for like 1 or 2 years, then you can move from there. So you will get the job as soon as you graduate.
Yeah, like a reimbursement. I think they have that reimbursement program when you're employed, and so if you maintain good grades, they also reimburse you for when you're going from patient care technician to nursing field as well.
I was gonna suggest for high schoolers that if you really wanna secure your spot for a position at a hospital, it can start early as high school. You can get into a nurse tech program, which is about a few months. You can work in the hospital as a nurse tech, and then get reimbursement to go into the nursing program. There's fabulous programs out there. I know a nurse tech that started as a nurse tech, work maybe like 2 shifts a week and did a nursing program. The hospital paid for Baylor paid about $8,000 a semester for her. And, you know, from there she became a nurse. And now I know that she's enrolled in a BSN program. So if you really, really want to get into it and save a lot of money, you can start as early as being a nurse tech, get your foot in the hospital, and then get your organization to reimburse your education for you. I know I have a lot of people. I couldn't do that, obviously, because I was a foreign student when I came in, so I couldn't work here as a nurse tech, but I know my fellow colleague, my fellow graduates, most of them did that. So that's another way of getting yourself in.
Perfect, thank you. Any other questions from our attendees? I had one comment from Isra that I just wanted to add, you know, that the aspect of nursing as a noble profession, sometimes you do hear sometimes in our community that they don't hold nursing to a great standard. I always think that's a typical stereotype, you know, or, as a false kind of a claim. We work very hard in our field, and it might be different compared to other parts of the world, but here, whenever, you know, I've entered in the field, you know, the doctors trust us so much, you know, so much responsibility that it's actually a privilege of what we can do, you know, in the nursing field, wherever we work. You know, there's a lot of empowerment. Our profession is quite noble. It has quite a bit of responsibility, quite a bit of critical thinking is involved. So it's not something that easily is attained, it's earned. You know, when we are in school, they rigorously work, you know, getting those concepts into us and making sure that we learn these practically in clinicals, making sure we have these skills so that we can provide safe patient care. One thing is the board of nursing is not very kind, you know, to any kind of, you know, negligence or poor acts in nursing. You know, they watch to protect the community, and so they hold nurses to very high standards, making sure that we know what we're doing, we know how to critically think, that we are able to perform, you know, very critical tasks in the you know, for patient care. We're on that, you know, we're a bedside nursing. You know, the main thing is when you're with patients at the bedside, you're watching them in their most critical states, and so that takes quite a bit of responsibility, quite a bit of knowledge base, and we get that through our programs. They hold them to very high standards for that.
And also, I guess just to add to that, doctors have a lot of trust in the nurses, because doctors get to spend just a couple of minutes with the patient, and so the nurse gets to spend more time with these patients. So the feedback that we give to the doctors take that into consideration before, you know, analyzing the whole situation and making up a treatment for the patient. So there's a lot of trust between doctors and nurses, and a lot of respect as well.
Yeah, definitely, it's a partnership between doctors and nurses for sure, like a team approach actually, rather than a kind of a delegative approach. I always see it as a good team approach in our field. All right, any other questions from our attendees or any comments from our panelists that they'd like to add on?
You did an awesome job, Aisha.
Oh, thank you. I'm glad. Thank you guys for coming. Thank you so much for coming. I appreciate it. So I appreciate all our panelists for taking their time out on a Sunday from their families. I'm happy that we were able to have this presentation for our fellow students that want to enter into the nursing field. If you have any questions or concerns, please feel free to reach us at amwpa.org. You know, if you have any questions, we're happy to answer them. You know, take advantage of our volunteer opportunities. I know a lot of it's on hold with COVID. Hopefully when this all shall pass one day, inshallah, you know, we'll have our programs once again, our health fairs. You know, we're always there for our community. You'll be able to see us live, hopefully, inshallah, one day at those health fairs again. You can meet with us in person if you have any questions or concerns. Thank you so much for your time and your patience today. I apologize for the technical difficulties in starting. So thank you so much. Have a good day. Assalamu alaikum.
Assalamu alaikum. Happy Sunday.
Assalamu alaikum. Thank you, Aisha.
All right. Assalamu alaikum. Bye.